Do you have painful swelling at the back of elbow like this patient here? This swelling is quite large, with buildup of fluid inside. This is not only tender to touch, but also limits elbow movement. Let's take a look of what's in there. A large amount of pus mixed with rice-like granules. The entire thickened bursa sac was then removed. This is a common condition called Olecranon bursitis. It can be caused by repetitive leaning on your elbows at the desk. It can also be related to bending of the elbow on the armrest while driving. Certain exercises or jobs such as carpet laying can often irritate the bursa. The elbow bursa is a small sac that reduces friction between the skin and bone during movement of the elbow. When there is repetitive pressure and friction, the bursa becomes swollen, inflamed, and starts to produce bursa fluid. Some other medical conditions such as gout or rheumatoid arthritis can also cause elbow swelling in this area. This condition can be treated mostly by yourself at home. We have outlined some treatment options here for you to try. When the elbow is painful and swollen, try some simple anti-inflammatories and remember to avoid direct pressure of your elbow against hard surfaces. An elbow brace is excellent to control swelling, and more importantly, it limits repetitive bending of the elbow that can further irritate the bursa. If the bursitis persists after 6 weeks, you can consider seeing a doctor for needle aspiration. This simple treatment can be done in the doctor's office under local anesthetics. After the procedure, it's important to put the elbow into a tight strap to stop the fluid from building up again. Surgery is reserved for patients whose bursitis keep coming back despite other treatments. The surgeon removes the entire bursa sac to stop recurrence. This patient has a large amount of fluid in the bursal sac with white gouty deposits. The bursa is then sharply removed so there won't be any further collections. Here, you can see the thick lining of this inflamed bursal sac. Surgery is a very effective treatment for this condition. It takes 2 to 4 weeks to recover. It's recommended to avoid excessive elbow bending movement right after surgery to reduce swelling. Occasionally, the surgeon will remove some small bone spur to further reduce irritation to this area. I hope you find this video useful. Please comment below.